Empathy. So what is empathy? Well, empathy means in feeling. Literally comes from the Greek origins, the two words em meaning in and pathos meaning feeling. So in feeling. The two words comes together and makes the word empathy. Okay? As we know it today, the word simply means to feel what someone else is feeling, to feel what someone else understands, to feel what someone else is going through. That, in short, is what empathy is. So what these renowned psychologists say is that empathy can be looked at from three different angles or three different facades or three different directions. And it's very important to look at them from the three different angles. And these include emotional, cognitive, and compassionate. Emotional, cognitive, and compassionate angles. And I'm going to describe to you what each of those is about so that you have a really good understanding of empathy. So, first of all, cognitive empathy. What is that? Well, cognitive empathy is sometimes phrased as perspective taking. Taking into perspective, we often say. Well, what that means essentially is to kind of have a feel for what a person might be going through. So, for example, you might have a patient who's going through financial distress. So you might think, okay, well, if they're struggling for income, if they're struggling financially, then it might mean that they're going to struggle to pay the bills. They're going to feel stressed about it. They won't be able to feed themselves or, go to do certain things that they do regularly. So that might cause some distress in their situation. So you can kind of have a feel for what's going on. And that's what we mean by cognitive empathy. That in itself, as you can imagine, does not round up the full aspect of empathy. And if you do practice cognitive empathy on its own, you'll remain distant to the person you're working with. To really connect, to get close to them, you need to understand the next area of empathy, which we often refer to as emotional empathy. Okay, so what is emotional empathy? All right, this is the second part of empathy, which I want you to understand and have a really good feel for. Now, when I talk about emotional empathy, or indeed when psychologists talk about emotional empathy, what they're really talking about is that you have a really good feel for that issue. So, to give you an example, imagine somebody's kind of talking to you about spraining their ankle. Right. So when they've sprained their ankle, you must imagine that they have gone through a certain amount of experience. They've felt pain. They've felt certain amount of restriction. Sometimes when people say that to you, you might kind of make a physical impression, like you might kind of cringe, or you might say Oof, something like that. So you kind of physically react, almost as if you have experienced that yourself. All right, you might feel hair standing up on your arms or something like that, or on your back. Well, this is emotional empathy. You're actually feeling, you're actually connecting with what that person is going through. And that's the second stage of empathy. It kind of builds on the cognitive element, and it kind of gives you a heightened level of empathy. You're getting closer and closer to your patient. Now, to be able to get closer to them, to be able to do even better, you need to think about the third area, and that is compassionate empathy. So this is it now, all right? This is the final aspect of empathy, which really, if you can deliver on that area of empathy, you've cracked it. You've understood empathy, and you've been able to journey with your patients and come to a conclusion. If you're not good at this area of empathy and not compassionate, then you'll struggle to connect. All right. So now that you've cognitively linked with your patient or your counterpart, now that you have emotionally linked with your patient, the next step is to compassionately link. So whatever you've experienced so far, you need to then do that third thing, which is to be compassionate and actually look for a solution, look for a way to resolve this problem with them or on their behalf. Whatever you might do as a solution, you need to come up with something. It's very different, for example, and I'm sure you'll understand what I mean by that. So if somebody's kind of complaining to you about some difficulty they're going through, you've done the cognitive part. then you might even kind of display some body language or some emotions to show an emotional connection. However, the next thing you do is you respond quite cold, or actually you're too busy, you're focusing on other things, so you don't actually deliver on the empathy. So can you see, even though you connected well on a cognitive level and at an emotional level, you've actually failed to deliver on a compassionate level? And this is the bit that a lot of people fall apart on. This is the bit that they fail to deliver on, and therefore quite often patients and people think that you're a distant, you're a bit cold, or you don't quite get them. All right, you might have come across this before. It's this area that we need to be careful about. So those are the three areas, guys. All right, the cognitive element, the emotional element, and the compassionate element of empathy. I hope you've understood now in a holistic manner how we become better at empathy and how we can connect better with our patients. So now that that is clear in our mind, the question now is, why is empathy important? How is it such an important skill that a healthcare professional needs to think about it, needs to practice it well, and be able to deploy on a regular basis? Well, in my honest opinion, in my humble opinion, I believe empathy is perhaps one of the most important skills you can master. I hope you can reflect on some of the concepts and some of the issues I've discussed earlier and be able to practice them so that you become a better empathizer, so that you can become the most awesome doctor out there. In terms of survival skills, why am I kind of putting it like that? Well, let me explain to you what I mean by that. I sincerely believe that as a doctor, as a healthcare professional, it is our duty to be able to sense people, to be able to sense distress, to be able to sense pain, to be able to sense psychological, mental, physical distress a person is going through. All right, that is the kind of first level of connection. You remember the cognitive connection I was talking about with empathy? Well, this is exactly what I'm saying. You need to be really good at that. Because if we can sense people's distress, then what we can do is we can respond appropriately, right? In terms of responding, we'll be better at the way we behave towards our patients. We'll be better at connecting with them on that level. We therefore might communicate better. We might even be more helpful as a result. And because we're effective in that way, if you remember, the emotional aspects of empathy will be so much better there. We'll be able to emotionally connect with our patients. Once we've done that, what we then do is, if you remember, it's the compassionate element of empathy. We will be able to deliver for our patients. And when we do that, what we find is that not only have we resolved, or at least we've helped to achieve some kind of resolution for our patients, or give them hope, give them a chance to come out of the depths that they find themselves in. Not only are we going to hopefully achieve that, but also we're going to help achieve positiveness, effectiveness, a really good mindset for ourselves, because we're able to improve our patients' conditions, our patients' kind of journey towards health. So that's the element, if you like, you might have already identified, is the actual compassionate side to empathy that I'm talking about. It makes you more effective. In being effective, in enjoying your work, in being able to deliver, what you'll find is that you won't burn out easily. You'll enjoy the work that you do. You'll be really good at what you do, and you must believe me there. I've been doing this for many years, and I'm not too bad at empathy, and I find it's a fantastic skill to have.